Anderson, substance use disorder certified counselor and clinical supervisor. She's the voice behind Addiction Full Circle, a blog that combines lived family trauma with professional recovery insight. Dee didn't pick up the drink, but she carries an imprint of addiction, being raised by parents who struggled with substance use. Today, she helps other people rewrite stories of addiction that were handed to them while working on healing on her own. Dee, I'd like to begin with something that you shared in your writing. You said that your father was more of a mystery while your mother was brilliant but had her issues. I'd like to talk about some of that growing up in the midst of that, growing up in addiction all around you, even though that you never used, as you wrote, addiction showed up differently in both sides of your family. What were the earliest ways that you noticed addiction impacting your parents, even if you didn't have the words for it yet?
For me, the blessing that I had is I did have grandparents who kind of sheltered me a lot from some of it, but there were times when my parents would just be absent. I'd be with my grandparents and they'd be absent, particularly my father. My mother would come around, she'd come pick me up, take me for days, and then bring me back. Right. And in that time, I would see different actions she did. I never saw my dad's addiction. It really was a mystery, like I said, to me that he had a substance abuse problem because it wasn't present. I never seen him partake in the activity, but I have seen my mother. So it was just mainly the absence that let me know, okay, something's not exactly right here. Why aren't my parents like raising me? Why aren't they here?
So you mentioned some of the behaviors that you've seen, and I know this is kind of difficult to share sometimes. I get like real anxious when I share, but I remember my parents, they would like hide in the bathroom when they were using. They kind of went in and out of
Mm,
using, but hiding in the bathroom and then coming out and acting like nothing happened. And it would be like multiple people, like them and their friends. What were, if you're comfortable with sharing
okay.
that, what were some of the things that you've seen?
Like I said, I'd never seen my dad partake, but like with my mother, like she would just like take me. We would go buy buy the drugs from some random guy. She would come back and she would just smoke them right there, like she was smoking a cigarette, right? And I don't even think that she realized that I was paying attention. Right. Because the earliest I remember is around like 3 when my mom was doing something. I didn't even know what she was doing, but one day randomly, like SWAT came and like had me up against the wall. I vividly remember being in my underwear and like urinating on myself because I was like, what is happening? That's the first instance of any like I would say trauma that I experienced. I later in life learned that it was because of PCP, right? And that's the first time my grandparents really started getting involved. But that one event, I remember vividly, like I could draw a picture of it, right? And so after that, it was kind of like just the random, disappearances and then smoking right in front of me, like it's no big deal. But I think maybe in her mind, since I was so young, maybe she had that attitude of she doesn't know what I'm doing.
Yeah, like I would find my mom like hidden in the closet. I'd be looking and looking for her, and I found her in there high. And I remember a situation with my dad where we're trying to get out of Oklahoma as quick as possible. I didn't understand why we were moving so fast, and we had everything loaded up. And before we could even get out of town, I think we just made it a few blocks down the street. So cop cars pulled us over and took him to jail. That's a very, very intense situation to witness. So in your writing,
Yeah.
you described stuffing feelings, the overfunctioning, judging yourself, and these are traits from the Adult Children of Alcoholics laundry list. Do any of those hit home for you, and which one most?
I think that I didn't really start thinking too much about my part in it until I got much older, right? And I started getting into learning about substance abuse that then I started having a little bit of guilt, like, dang, I was so mean. I was so judgmental, right? But as a youngster, I just felt I was always angry, always angry. I can't remember a time when I wasn't angry. I was angry at just lots of things in my life. My parents not being there, me being raised by my grandparents and not feeling like that emotional love, that emotional support, because my grandparents were older and they were raised in a different time where you didn't really talk to kids about feelings and things. It's just like, this is grown folks' business. We don't need to tell you what's going on. So it was plenty of time I just stayed in my room. I was a good reader. I used to love to read, so I would stay in my room and just kind of isolate, you know? I didn't think about it at that time that it was because of those events. But thinking back now, it's like I spent a lot of time by myself because I just didn't want, I like had this like mistrust for people. And I didn't even want to be around anyone, not even like people my age, you know? So I spent a lot of time in my youth by myself. I guess that was my coping mechanism at that time.
I totally, totally relate. There are so many things. I did go a route of substance use, and I used for about 10
Mhm.
years, all different substances, but I really leaned more towards amphetamines and,
Mhm.
experienced homelessness, breaking into people's houses and stuff, and things like really outside of my character at the end.
Yeah.
And then I thought like, okay, so I'm gonna put down the drugs and alcohol and everything will be good, right? Everything will get better. Well, what I found out
Mhm.
was there's all this
Yep.
other stuff that I had. And so when I started going through ACA, really learning more about how growing up with people, with parents who have that addiction or have that alcoholism, how that can really affect your ability to have relationships or what that looks like. Not that you can't work on it, you can work on it. It's just a different type of recovery. Is like
Mhm.
that second layer of
Right.
recovery I had to work on. So in your relationships, how does it affect you today? Is it something that you are continuing to work on, or what does that look like?
Now, because of I would call that trauma that I experienced, it is hard for me to form relationships. It is hard for me to trust people. I'm not that give the person the benefit of the doubt person that I could be, right? It's like, wait, let me have my guards up first. And then if you show me, right, then I'll trust you. But it's always like I approach people and situations on guard already. I'm already defensive, like this person's already going to hurt me, they're already going to betray me. And so it makes me, like I said, always kind of be like on a 10 most of the time. I have learned though through working with others in this field and with some of my clients that that has been my coping mechanism, right? I already push you away with my defense. So then you don't even get close enough to hurt me. Right. And I've learned now that that is my coping mechanism and I've worked through it. And it continues to be something that probably I'll always have to work through because in life you come in and out of different relationships, right? And I know they say like you can't, like judge someone by somebody else's actions, but it's hard when the first relationships you're supposed to have is with your parents and that one was not successful.
Yeah, that fear of abandonment or rejection. I know it was
Hmm.
something. If you would have asked me earlier on, before I was aware of those type of things, I would have said, no, no, I don't care about none of that, or I don't have a problem with that.
Right.
But as I started working on it,
Hmm.
I learned that it was rooted in control. I did not want. I was so afraid of being rejected. It was easier for me to push people away or to
Right.
cut people off than it was to work through that relationship. I knew how to do that because I seen that with my parents, but I didn't know
Hmm.
um, how to work past that at that time. So as I started learning more and more about those type of issues, I was like, well, I can't keep doing what I'm doing. I can't blow up or push people away. I need these people, and so that was an an awakening of like, okay, I got more to work on. Did you ever step into like the parent role or a rescuer role? And I know most counselors, we have our stuff too, which makes us really good helpers.
Yeah.
Would you contribute some of the stuff that you went through to maybe your practice today?
Absolutely, absolutely. Like with my mother, because she was more present in my life than my father, she would come in and out. The times when I did stay with her shortly, I was the rescuer, right? I was the parent because she wind up having another child. I'm 6 years older than my younger sister, and I had to step in and be like her parent, right? My grandmother jokes and says, I've been grown since I was 6, right? But I had to step in that role when I was with my mother. And then shortly after, we got placed with my grandparents, both of us. And even then, with my grandparents, I had to like take care of my sister, make sure you take care of your sister, watch your sister, And when you're young, you don't understand why. you're like, I don't want to do this. Like, this not my kid. I didn't have this kid. We don't understand, but it was a responsibility that was put on me. And, you kind of really don't have a choice but to do it, but I've learned since, and it wasn't necessarily becoming a counselor that taught me, it was actually becoming a supervisor that taught me that I have to kind of check myself more because as a counselor, right, you're more in the authority role, right? Clients come to
Oh,
you,
yeah.
they look to you, you're like kind of their savior. So they just hang on to what you say. So you're like, you're right. But as a supervisor, right, and dealing with my employees, I've learned, okay, I do have to, you know, enforce certain things, but I do also have to let down my guard to be able to receive, right? Because I deal with people and their emotions and their personalities. And if I'm always on defense, right, I won't be a good supervisor, right? Because they need to feel comfortable coming to me when they're struggling. And if I'm on defense all the time, that can't happen. So I would say that. And the husband that I have now, this is my second marriage, and he's much different than my first husband, but he really does give me the space to like be defensive, but with respect. He's like, okay, I'm going to let you like have your moment, right? But then you need to will it back in, and we as, children of addict parents, we learn to kind of fend for ourselves because we don't have that, that parental person to fend for us. So for someone to say like, like let down your guard, like it's like that's uncomfortable. Like what is that? And so we have, I'm sure you've had to do it as well, have had to learn like, okay, there's a time to be defensive, and then there's a time to not be.
No, yeah. So like with my wife, I give her all the credit for she definitely gives me a lot of grace, but it's more than just letting me slide. It's understanding where it comes from. Like you said, having your moment
Mhm.
and not letting that be the takeaway. And it's
Right.
things that she's given me grace on. But that's again, what I share about these type of things is, I wanted to change those behaviors. Still something I want to work on. I'm not completely over it, everything. I think maybe have a slip up every couple times a year, but it was like an
Mhm.
everyday thing, or it was like my life then, even though I was clean and sober, emotionally intoxicated. And so it was something that I had to
Yep.
work on. And it's very fortunate to have a spouse that allows you to, have your scars and have the trauma responses and then to continue to work through it, that's not going to be the end. And especially anything that would reinforce that fear of rejection or reinforce the fear of abandonment, because that would make it worse. I mean, I can say that my wife has never once said like, "Hey, it's over," or any those. She's never uttered those. It's not even in there. And it took me a long time
Yeah.
to like really get that in my head because of what I've seen over and over again. That's an expectation. So it's like, yeah, I'm still working on that stuff.
Yeah, absolutely. And it's important that our spouses know the triggers, right? Because that's the biggest thing, right? Is that you do want to change and you want to be better. But if someone is, like pushing that button, right? It's hard for you to, it's almost like seeing red, right? Like, okay, this is a trigger. Like she's reminding me of my parents. She reminds me of this incident that happened. And it's kind of our responsibility to kind of let them know, hey, this is a trigger for me. I understand that I might be on one right now, but certain words, certain behaviors are triggers, right? Because at the end of the day, we've learned through our clinical work that those are the things. It's not like you don't love someone or you don't want to be with someone, but it's the triggers that kind of cause the reaction that you really don't want to have, right? But we have learned that, okay, this is a sensitive area for me. I still need to work on this. So I kind of need your assistance with it.
Yeah, I can still remember the day of like when I realized. Of course, as a counselor, we know what an internal dialogue is. I didn't know that's what it was when I was driving down Marshall Avenue or Highway 80 is what it intersects there. But I was driving down that road. And I remember
Mhm.
I was enumerating on an event that hadn't happened, and basically what it came down to is I can't trust her. I can't trust her, and I just kind of
Mhm.
realized like nothing has even happened. Like, what am I thinking right now? Like, where is this coming from? And I was going to counseling at the time. I had been 3 years sober, just got married. A lot of stuff was coming up, and little had very little to do with her. To be honest, it was all my junk
Mhm,
starting to come up, and I was like, I'm thinking about this event in the back of my head, and it's affecting how I feel right now towards her. And that was, due to counseling, talking through those type of things. Was there a moment when you
mhm.
started realizing that even though maybe you weren't using or drinking or anything like that, that it didn't mean that you didn't have like wounds? Like, was there a specific event or thought that just kind of made that connection for you?
I think that actually I probably had several of those moments, unfortunately, but I do kinda remember that the heaviest moment for me was it usually always comes before, I don't know, a happy moment for some reason. Like, I think, like the stress, right? The stress is the trigger. But it's like right before a happy moment, for some reason, I always start thinking about the everything that could go wrong, everything that you don't deserve this, and just all of the floods of emotion, right? And then you do start thinking back to, well, that's probably why this happened, or that's why this happened, right? And for some reason, we catastrophize it, right? Like, oh my God, like, why would he want to marry me? Like, I'm such a mess. Like, my parents, this, my that. And you start spinning, just start spinning, right? And like you said, nobody's thinking that but me. And nothing is even happening. But it's like that happy moment, that stress of this is really about to happen. Like, this is a change, right? It brings that flood of emotion where you start having those internal dialogue of, I'm not enough. Why is this happening? I don't deserve this. Like, and I think it does go back to, we think about it like this. If my parents didn't love me enough to do XYZ, why would this person love me enough to do XYZ? Maybe it's me. Maybe I'm the problem. And like I said, nothing has happened, but these are the stories we tell ourselves because we're so used to either trauma, we're so used to bad relationships, we're just so used to not having that good in our lives.
There was someone who was explaining to me about, sorry, we were talking about maybe going skiing, and they said, like, if you start to, don't look at the trees, because if you, whatever you look at, that's where your skis are going to go. And,
Hmm.
and I was again working on some ACA stuff and really diving deeper
Mhm.
into the fear of abandonment, fear of rejection. And it was completely unrelated. It wasn't talking about anything like deeper than skiing, but it finally clicked in my head, like that's what I keep doing. Is I'm so afraid of this person leaving me. It's like somehow it gravitates towards that, and then I get to say, well, I was right. I knew that was going to happen. And
Mhm.
again, to feel some sort of control, which is absurd. Like, that doesn't make any sense in the world. But when they describe, don't look at the trees, and it's kind of like what you're saying is like that internal dialogue is there, and we've created the story, we start to believe it, and then we want to be right, so we go and find all these events that that support that
Mhm.
that belief, that irrational belief we have. So
Right.
what helped you stop reacting to life and start choosing how you wanted to show up? What was that decision, that final straw of like, okay, well, I don't want to react, I want to respond in this way instead?
It actually didn't click, unfortunately, until I got married to my husband and the way that he deals with me. Because all my life, I kind of have had this, like I said, push people away. So people just allow me to do that. Okay, she don't want to talk or she don't want to be bothered. Okay. But this husband was like, nope, you don't get to do that. You don't get to do that. We didn't get married for you to do that. So have your moment and then you need to come back around. And so that forced me to kind of like own my own stuff, right? I could no longer say, well, you made me mad, or you, like, I don't like how you're behaving, and, you hurt my feelings. I had to say, like, okay, what part did I play in this, right? I really had to sit and say, could I possibly be the problem, right? Because we never want to say we're the problem. Like, I'm not the problem. Everybody else is. And that's the first time in my life where I really had to be accountable. You know, I couldn't just say what I wanted and do what I wanted. Like someone was holding me accountable, and accountability is hard. It's hard because we do want to be right. Like, I'm right. It's my life. I'm grown. This is what I want to do. This is how I want to talk. But that's not always appropriate. So that,
No, it's not. Yeah,
and I've only been married 7 years. And I'm 47. So like it took me like 40 years to get it.
it's a everyday learning process and
Yeah.
similar experience. I don't think if it would have been for her saying no, that's not how it's going to go down. We're married. We're staying together. That's not even an option. Even
Right.
though like the things and I would do and say like that's not really what my heart wanted. Is more out of the fear that those would
Hmm.
be
Yeah.
reactions to have somebody see through that and say no, that's absurd. This is what we're going to do. Was really, then after reflecting on it, it's like I can't get to that point that this cannot continue to happen, and to talk about it more and to keep working on it. Uh, and even after I kind of work through some of the other laundry list traits, there's others that show up and I become aware of, and like I really need to get this work on this. Was you mentioned earlier triggers that your spouse knows those triggers? How do you communicate what those triggers are, or boundaries? How do you set boundaries, healthy boundaries, in a way that isn't like shutting people out, but letting them in?
We have a rule. Our rule is the 1 hour rule. So if you're in your feelings or you have you're mad about something, have your hour, you know, go in there, curse out in the bathroom, go cry in the shower, go punch a pillow, whatever you need to do. You got your hour, do what you got to do. And then you have to come back and talk about it though. And now needs to be resolved, right? And I think that is the biggest change, right? Because usually we hash it out and you go your way, I go my way. We both sitting on the same couch, but not talking to each other. And that's how a lot of couples resolve it. They don't ever come to a meeting of the minds. And that has been the biggest and the best thing, right? Because I'm used to just, I'll tell you whatever I got to tell you. And, I'm in the next room going to do something else. And then you just are sitting there with those feelings. We never come back to it until that something else comes up. Then you bring that up. Then it's like now we're fighting about two things, right? And so it's really getting to a place where you feel comfortable to say, you know what, that hurt. That was a trigger. Because we know that anger is a secondary emotion, right? It's usually fear, it's usually hurt that shows up first, and we don't know how to deal with those emotions, so we get angry. But what I've learned is that, at least with my husband, I can't do that, right? I can be upset, but I have to still find a way to get past it, to communicate about it. I can't just like run and hide from it, but I think more importantly is that communication, right? Because if you don't tell the ones that are close to you what your triggers are, it's hard to set a boundary, right? Because if they don't even know, then how can you hold them responsible, right? So it's kind of just communicating that, okay, this is a boundary here, right? I don't like for you to talk about this. I don't like for you to do this. It reminds me of this, right? And I think also it's important when you're setting boundaries to kind of explain why the boundary needs to be set, right? Not just say, don't walk out without telling me where you're going. Okay, but I'm grown, right? The second part is explaining why, because that makes me feel like you're not coming back. Right. So set the boundary, yes. But in your close relationships, you also have to explain why so that they have a clear understanding like, okay, no, she's not just being a B word or whatever. It's because of this. I have found that that gets people to kind of understand why you need what you need, is explaining it, right? And a lot of times we don't want to because we're like, I'm grown. I don't have to tell you. I don't have to tell you. But you do. But you do.
That is a really great template I think we can apply, is explaining the why behind our boundaries, because like you said,
Hmm.
they may perceive it as a whole different way that we didn't intend to, and to give them the
Right.
understanding so that it's not just something that they can't do, but most times our loved ones aren't, or more times than not, they're not trying to elicit that response. They may just be unaware that A plus B equals C. In your clinical practice, what inspired you to become a clinician? What inspired you to start the blog? Are they separate or are they the same? Her blog is addictionfullcircle.org, and that's how I came to find you. Is I was reading through. I was like, I want to meet this lady. I want to talk to her. What inspired you to become a counselor and to start writing the blog?
So I decided to become a counselor, unfortunately, because my mother died of an overdose. And that was kind of the pivotal moment for me to really learn more about why. The question for me was why, and that's been my question my whole life. Why this over me, why that over me, why choose this life, and so that kind of, once she passed away, I was left with so much like, why did this happen, and my curious mind wanted to know why. And so then I decided to go to school. I decided to get certified and also get my degree to find out why. And it really was that simple. I just wanted to know why. Then my husband is the one that actually encouraged me to do the blog because the why is still there, not necessarily for my parents, but now for my clients. Right? It's figuring out the why, because I feel like if I as a clinician understand the why, then we can work from there. Most of us know that most substance abuse is preceded by trauma, right? And a lot of times people aren't even aware of the trauma. I'm sure you weren't and I weren't aware that the things we were going through were traumatic, right? I talk about the SWAT team coming in. You know, what word is that? We don't know that word is trauma, but I want to know why. And I want to be able to help them figure out the why. So then we can get to the root of the problem. Society says, well, you're just using drugs, just stop. Just stop. And if it was that easy, we wouldn't have a job. But it's kind of getting to the root of the problem. Why does somebody use for 40 years, loses everything, loses every relationship, lose their home, lose their job over this substance, right? And when we trace back, we learn that it's could have been something that happened in their childhood that was never resolved. It could have been some trauma they experienced in a relationship, right? So trying to figure out that why has always been my drive for getting into the field. And then, like I said, kind of working through being accountable led me to want to do the blog with the encouragement of my husband. But I was like, okay, I really feel like now I have a better understanding of why I was the way that I was, why I felt the way that I felt, right? Because before getting into the field, it was just superficial. Parents are supposed to be parents, relationships are supposed to be, like flourishing, good. Like, what is this substance that is preventing my parents from being parents? Right. And it's just like I said, the whys were so loud in my head that I needed to find out why. Even if I'm not going to get the answer clearly from my mother, unfortunately, because she's passed away, I can have a sense of understanding as to why her life was the way it was. And that's why I write about it. From my perspective, right? I'm pretty sure if my parents read my blog, which my dad is alive, I haven't told him about the blog. So we're going to work through that. But they will have their whys too.
Mhm.
And so I'm exploring that right now, the whys.
How has your understanding changed prior to becoming a clinician to now? I know that there's still whys, there's still questions, but how has your understanding of
hmm
addiction changed?
Well, I would say that there's this word choice that a lot of people have, right? Especially people that do not have an understanding of substance abuse. Choice, right? And so for me, I always thought you have a choice, right? You know, Typically you do have a choice, right? You do have a choice. You have a choice whether you pick up that first drink. You have a choice whether you smoke that first hit, right? However, after that, it becomes less of a choice, right? And that's the part that most people who aren't in this field don't understand, right? I used to hear that a lot, especially when I first got into the field. especially by family members, unfortunately, who have no idea. Well, they're choosing. And that's how I felt. Like, you're choosing drugs. You're choosing not to be a mother. You're choosing not to be a father, right? But I've since learned that although that initial is a choice, the subsequent actions are not always a choice, especially when you're in the field of like opiates or alcohol, right? It no longer becomes a choice. It honestly becomes a need to function, right? And so once you cross that barrier and now you're into like addiction, right? It's no longer a choice. And so that's been the biggest lesson that I've learned by getting into the field is that although the initial, like I said, is a choice, the continuum is not necessarily a choice.
No, yeah. When I started learning more about the disease model, I was like, what? And then it was actually about maybe 2 years ago. I just mowed the lawn. It was late and it was summer. It was late in the evening and it rained just a couple days prior. And I was looking at my lawn. Dogs were playing in the back. We had put up these solar powered lights. They're like little light bulbs.
Hmm.
And it was late in the evening. And so they clicked on. And when they clicked on, it caught my attention. I looked up and in the light bulb was a little bit of water. And my mouth just started watering because that's how I used to smoke meth was out of a light bulb or a glass pipe. And I felt,
Mhm.
and at this point, I was a counselor. I think I was an intern. No, I was either an intern or just now got my full license, and my mouth was just watering, and I felt shame. I felt guilt. I got this house. I got a beautiful wife. All these dog babies. Great job, and like why? Like I almost felt like ungrateful that I would be able to have that sort of reaction to something. And then my counselor brain took over and it's like, well, you've conditioned your brain to this response through the reward system. It is just simply a trigger. It's now at this point, and it's an unnatural response, but because of the way I've geared my brain over the past, over those 10 years, that's why my cravings is responding in that way. And
Mhm.
again, learning about the disease model, it changed the way that I looked at my parents with a little bit more of
Yeah.
understanding, a little bit more
Mhm.
empathy. Yeah, they did what they did.
Right.
They are who they are, all that stuff. But now I understand them in a different way by learning that. And choice is also a really big thing. I was talking earlier about control. Even though it's causing a bunch of damage in your life, it feels good to be in control until you
Mhm.
have the come down. It's much like drugs. It's like when you use a drug, it feels great until you have the come down. It's the same way with trying to be in control. If
Right.
you try to be in control of everything, there is the inevitable loss of control. And learning that choice of, well, I can't control everybody and I can't control everything, but these are the choices that I can make. It's the same way with our emotions and learning to live in that emotional sobriety. Did learning more about the disease model help you with your understanding of your parents and the feelings that you have towards them today?
Absolutely. I feel guilt sometimes that it's guilt that I put on myself, right? But I always say, well, man, if I would have learned about this, I could have helped my mom. I could have saved my mom. I could have stopped her from overdosing, right? I really put that on myself when I first got into the field because I'm like, how am I going to help other people? I couldn't even help my mother. The internal thing that I'm telling myself, even though at that time, first of all, I didn't know anything about it. But secondly, there was nothing that I personally could have done. She probably wouldn't even listen to me anyways. But regardless, I think about it sometimes with my father, but it is still a very sensitive thing for me, because we've had a up and down rocky relationship throughout my life. And in my mind, the things I tell myself, right, is that, okay, if he fully tells me about his life and his substance use, it would hurt me, right? Of course, I'm making it personal, but I feel like it's some things I don't want to know. Yet the why stays there, right? Because that's my main goal is the why. But I'm kind of fearful to get that answer, right? He's the only one that could give it to me, right? But I've never asked. And that's why in one part of my blog, I say, do I have time? Right? is that, some people say like open up Pandora's box, right? You may not want to know, so I still struggle with that part. Do I really want to know? But having my blog has helped me at least open up my vulnerability to being able to probably ask that question, right? It's given me the courage to tell my story that I haven't told for so long, mostly out of embarrassment sometimes, right? Nobody wants to admit that their parents are drug addicts, right? Especially like when you're in school, you get teased, your mom was a crackhead, So as an adult, learning to say, it's not about me, but it is about me and my healing. It is about me and my understanding, but I'm still on the fence of the why with him. And that's why it's still mysterious to me. With my mother, she kind of told me a little bit more. And I know my mom's she started because of trauma, her mother and her sister being murdered by my uncle. It's traumatic to lose your whole family in one fell swoop, right? And then living with survivor's guilt because the story I was told is she was supposed to go and didn't go. So she's not only living with the trauma of the loss, but she's living with the trauma of the survival and not having the tools to deal with that and turning to substances instead. So, I have a little bit of her backstory. I don't necessarily have that yet from my father, besides the stories he's told me of starting it in the war when he was in Vietnam. But after that, we haven't really had full discussion about it. And so I'm still searching that why. And I'm hoping that, through my blog, I will get my own courage to be able to ask that question one day.
What tools do you recommend for your clients or anybody that is trying to break out of reactivity into more of intention?
The first thing I think is to really talk them through the understanding of the disease, right? So many people that have this disease feel shame, they feel guilt, they feel embarrassment, right? And getting them to understand that this is a reaction sometimes, right? Not necessarily you're such a bad person, because that's the first thing that a lot of people say, like, oh, I'm such a bad person. I, chose this over my child or over my, wife. Getting them to understand that it's a disease, right? So we kind of lift that guilt off, lift that off their shoulders. Like, okay, so not that it's normal, but it is normal, right? And so once you can normalize it, right, you take away some of that guilt and shame, then we can get to the heart of what's the real problem. But as long as people are operating in that guilt and that shame, it's hard for them to see anything else. It's hard for them to see a future. It's hard for them to see mending relationships, right? Because they stay in that closed compartment of, well, this is just how my life is going to be. I've messed up too much. I can't get any of that back. So kind of letting them know, like, hey, what you experience is normal, right? It's normal. Now let's work through it. Let's work through it, right? Because although like it's normal to get angry, doesn't mean that you have to stay angry, right? Just because maybe you got addicted to pills because you had a car accident. Okay. It does happen, right? You're not abnormal. It does happen. But now let's get to a place where we address, why are we still doing this behavior? Right? The car accident is over, right? We're no longer getting pills from the doctor, at least. Now let's figure, is it the pain? Is it that you don't have coping skills? Those type of things. So that's what I usually work with my clients. Now, I did that a lot more when I was just a regular counselor, more as a supervisor. I'm more kind of like guiding my counselors and things, but I do still have a small portion of clients that I deal with on a daily basis. But now in my supervisory role, I'm more of an overseer than, so much directly working with the clients. So that's the first thing, is to like kind of shelve that shame and that guilt, because that keeps you in a place of stagnation, you know?
In what ways have you reparented yourself? So I know for myself, when going through the ACA 12 steps, when I was introduced to the idea of reparenting and the inner child and all those concepts, I'm like, what is this? This sounds weird. But as I worked through the 12 steps and having situations come up and to be able to sit down and have that inner dialogue about those laundry list of traits, how it brought about those emotions, where it really came from, the consequences that I'm experiencing now with the rift that I brought about because of some old stuff, and basically having the father son talk. How has reparenting played out in your life?
You have to really learn how to be, right? I've had to learn how to be a person, I would say, because like I said, I was used to isolating, right? If I don't want to deal with something or someone, I isolate. I don't want to talk about it. I'm not going to work it out. I'm just going to isolate. And so in my life, I have learned that I do have to face things head on, right? Unfortunately, even if it makes you feel uncomfortable, right? I've had to get rid of my own guilt, right? Like I said, the guilt of, being me, of being a little bit honorary, not just to my parents, but to other people in my life. And come to an understanding that those were trauma responses, right? That was my coping mechanism at the time, right? But now, right, understanding those things, trying to change those behaviors. Because although it was my coping mechanism now when I was going through it, it's not okay to be that way now. Right. I not only do I deserve good relationships, but the people that I love deserve a good relationship with me. Right. And so we have to do the work because unfortunately we're products of that. Right. And it's not like we could go back in time and change it now that we know what we know. Right. It's like how they say hindsight. Right. Now we know that's trauma. Now we know, that was their stuff, not our stuff. So now it's like part two. Part one was, going through the trauma. And then part two is recovering from the trauma. And I would say that's the hardest part. Some may disagree with me, but I think recovering from the trauma is the hard part because when you're in that trauma, you know what that is, right? Like once you learn your parents are drug addicts, okay, you know what that is. Okay, my parents in the closet or they in there or they getting high, whatever. But now to take that and turn it into like almost triumph, right? That's what helped me be a better person. That's what helped me do whatever, right? And so now learning how to be this new person versus this isolated, mean, person is harder because that felt good. I mean, that was my comfort. Like, psh, I don't want to deal with you. Psh. Now saying, okay, even though I don't want to deal with this person, check myself. Why is it that, it goes back to the why. Why is it that I don't want to do it? Is it them? Is it me? Right. And then working through that. That's the hard part to me. Is working through it and recovering. Right. Just like being in recovery. Right. They always say, like, doing the drugs is easy. Like that's what you do, right? You're gonna get high, you don't want to do it. That's good. But now taking that away and like dealing with life on life's terms, wait a minute. What
No,
is
I said that
this?
exact same thing when I was an intern. A supervisor said, uh, "I don't understand why they do drugs. It's a hard life." I like because doing drugs is easier. It's easier to make the wrong choice.
Yeah.
It's hard to do it right
Mm-hmm.
every day, day in and day out, and do the hard work. And I think you describe it accurately. Of it's almost like a place of comfort. I was listening to a podcast, and they were describing how people, say in New Orleans or these other regional areas, when the hurricanes come and completely cause so much damage, and then they have to relocate, and then they move back, and then it happens again, and they relocate and move back. It's like they said at some point, why don't you just move? Because it's home. And
Mm-hmm.
I think,
Right.
it is the same way with us and our trauma and our emotions is we can almost, it's chaotic, it hurts, but it's also home. It's what's known, it's what's familiar. And it's hard to start challenging that and working past it. One of the
Right.
concepts that's super hard is, especially in the 12 steps, of where you're not just looking at how the abuse and the traumatic events, how they affected you, but how you've taken that abuse and the traumatic events and hurt other people. And it creates a balance
Mm-hmm.
of, okay, well, I'm not completely innocent and all this. I've taken this and hurt other people. And that's That's not easy to do. It felt much better to feel like, well, the world hurt me. It didn't feel so good to to
Mhm.
look at it in the other way. How can people connect
Right.
with your work, addictionfullcircle.org, or maybe you as a counselor?
Okay. So my blog is personal. So it's not related to my professional, but people can go on addictionfullcircle.org and subscribe. You can comment, you can send me messages, right? If you are struggling, right? I would say the number one thing, and I know it's the hardest thing, is to get help. Right. And there are several ways to do that, right? You can Google, you can, on some local places, you can call like 211 411. The first step is to getting into treatment. I now work in MAT services. So I particularly work with people that have opioid addiction. I work at a methadone clinic. So we do provide clients with alternative medication for their substance abuse because of how opiates are. You get physically dependent on opiates as well. So that's the modality that I'm working in right now. And I would say that the first thing is, if nothing else, Google, right? If you don't know what number to call or a person to go to, look for help in your area because it's there. It's there. And I've had so many people that come into my clinic and say, I didn't even know you guys were here. Unfortunately, a slight Google search would have found us, right? But I think it's important that you understand that you are worth it. You are worth it. And some of us have done this for so long that we don't feel like we're worth it. Like, who's going to take the time to help me? Who's going to care about me? Right? Even if it's not a family member that cares, as clinicians, we do care. We do care. We got into this field because that's all that we do is care. Right? And if you're a clinician that doesn't care, you're in the wrong field. You have to care about this work because it is not easy work, right? It's not easy to convince people that they are worth it. It's not easy to convince people that they should make the change for their life, right? I'm pretty sure when you were going through your addiction, you weren't thinking like that. I mean, the last thing you would think about is that you're worthy of anything, right? This is what I get. This is what I deserve. This is what I set up myself up for. But you are worthy of recovery. You are worthy of a good life, but you have to make that decision, right? No one can make it for you. No one can do it for you. You have to make that decision. So, like I said, for my business, we are an opioid program located in Corona. We do have 3 offices, one also located in Moreno Valley and in Hemet. And like I said, without just giving out the name, you can do a Google search for methadone assisted treatment and you will find local programs if you have an opiate problem. If you don't have an opiate problem and you have a problem with any other substance, there's residential, right? There's intensive outpatient, right? But get into some type of care because you are worth it.
Last question before I let you go today. You mentioned
Yeah.
how sometimes the family members have a difficult time understanding addiction versus choice versus
Mhm.
the biological dependence. What would be your message to either those that are experiencing opioid addiction or the family members of those loved ones in addiction? What would be your message to them about MAT treatment or harm reduction?
I want you to look at harm reduction, treatment in general, but specifically harm reduction, because harm reduction does sometimes get a bad rap. As if your person, your family, your husband, your child was dealing with diabetes, right? You would encourage them to go get insulin, right? To take care of their diabetes. And that's kind of what I relate methadone, Suboxone to, right? A lot of people think that they should get on this and be on it forever. That was never the goal. The goal is to get you off of the illicit drugs, to get you on something to stabilize you, to prevent your withdrawal symptoms, and then get you off of that as well, right? So look at harm reduction as the middleman, right? The middle between being totally clean and being strung out on drugs. Let's get our families into these services so that they can get stable and then begin to live a productive life like we would like them to do. And educate yourself about addiction, because just like me, when I thought it was a choice, right? It initially is, but it doesn't become one after that. So educate yourself about what addiction is, what the different modalities for care are, so that you can be that safe space for your family member to get clean and to be able to be in recovery and be successful at it.
Thank you so much for being on today. Uh, your
You're
insight
welcome.
from your lived experience and your clinical experience, and then sharing that with our listeners. I know that it's going to help family members and people in recovery and clinicians to better
I hope
understand
so.
addiction. Thank you so much for coming on today.
Thank you so much for having me, Joshua.